Dr. Ken Landau. Thanks for watching. Let's talk about Phentermine. Phentermine is an oral standalone weight loss drug that was approved by the FDA in 1959, and still to this day, it's the most frequently prescribed anti-obesity drug in the United States. Overall, it ranks as the 210th most frequently prescribed drug, comes in a variety of different trade names like Adipex-P and Suprenza and Lomira. It's considered a controlled substance, so it's a Schedule IV drug, same classification as drugs like Xanax and Valium and Ativan and Ambien and Soma and Tramadol. Now, there are a lot of over-the-counter drugs that have similar names to Phentermine, but they're not Phentermine. The indication for the drug? Well, it's an anorectic. In other words, it decreases your appetite, so it's used for management of people who are overweight, but only for a short period of time. Can't use it for more than about 12 weeks, typically even less than that. But it's not a pill that you can take by itself and expect to lose weight. No. Calorie restriction and exercise, behavioral modification, all necessary in order for the pill to work. It's only for those people who have an initial BMI, body mass index, of over 30 or over 27 if you happen to have some cardiovascular risk factors like you're diabetic or you have hypertension or your lipids are elevated. Well, what's a BMI really mean? Well, it means BMI of 30. If you're 5 feet, you weigh more than 155 pounds. If you're 5'3", more than 170 pounds. 5'6", more than 190 pounds. 5'9", you weigh more than 200 pounds. But the drug isn't for people who want to lose just a few pounds because it has potential risk factors. It's a sympathomimetic amine. It's related to the amphetamines. It's a stimulatory drug. So you don't want to simply take the drug as the first choice. And tolerance is going to develop after you take it for a few weeks. It shouldn't exceed the maximum recommended dose because it is a relative of amphetamine. The dose typically, if you're taking the generic Phentermine, is 37.5 milligrams. Individualize it to get the best response with the lowest possible dose. Typically, you take it an hour, 2 hours before breakfast or after breakfast. Most people take the 37.5 milligrams, but you can break it in half. You can take 18.75 milligrams. You can take that half in the morning, half in the, before dinner. You shouldn't take it at night, late night administration of the drug, because remember, it's a stimulant, so it's probably going to end up causing you to suffer from insomnia. And because it's a sympathomimetic amine, in other words, stimulatory drug, it can have adverse effect on your cardiovascular system, cause coronary artery problems. If you have some narrowing of the arteries, cause a stroke or arrhythmias or congestive heart failure in some people, or uncontrolled hypertensive, shouldn't take the drug. Even if you have mild hypertension, there's some risk of taking the drug. As with so many of these kind of drugs, shouldn't take it within 2 weeks of an MAO inhibitor, shouldn't take it if you have hyperthyroidism, if you have glaucoma, if you have an agitated state. It's not for pregnant women, it's not for nursing women. And if you have a history of drug abuse, remember, it's related to the amphetamines, so probably shouldn't take it. And you shouldn't take it with other weight loss drugs. So for instance, the herbs and the over-the-counter supplements, or even the serotonin-like drugs like Paxil and Zoloft, probably good reason to avoid taking them together because there really haven't been any studies for safety and efficacy. Now, some side effects. Well, one of the major side effects that is very rare, fortunately, is primary pulmonary hypertension. It's unfortunately frequently fatal, especially if you take a combination of fenfluramine with Phentermine, but it can occur if you take it with Phentermine alone. Symptoms of pulmonary hypertension, well, shortness of breath and chest pain, like you're going to have a heart attack, that angina, or syncope or leg edema. Some people have a deterioration in exercise tolerance. So if you develop any of those while you're taking Phentermine, get off. And it can theoretically impair your ability to operate hazardous machinery, potentially hazardous machinery, drive a car, operate a heavy machine. Well, we know that you shouldn't take it with alcohol. If you take it with alcohol, it might cause an increased incidence of adverse effects. And if you happen to be taking it, and at the same time, if you're diabetic and taking either insulin or an oral hypoglycemic medicine, you might have to reduce the dose of insulin or the oral hypoglycemic medicine, certainly if you're losing weight. Other kind of problem is it can cause a valvular heart disease. So serious regurgitant cardiac valvular diseases, the mitral valve, the aortic valve, the tricuspid valve. It's been reported in otherwise healthy individuals, especially, again, in combination with fenfluramine, but it seems to have been reported with phentermine just by itself. And then, unfortunately, if you do develop some of the cardiac valvular disease, we don't really know what's going to happen, whether it's going to get better after you stop the pill, whether it's going to get worse, whether it's going to be stable. And then phentermine is one of those kind of drugs that you can become theoretically addicted to. It's related to the amphetamines. So if you have a problem with drug abuse, this isn't a drug for you. And it's not a drug approved for children. So if you're less than 16, this isn't the kind of drug to take. Well, because of the potential for overdose, it's recommended that doctors prescribe the fewest number of capsules or tablets necessary to do the job. Otherwise, if people take an acute overdose, well, there's restlessness and tremor and hyperreflexia, and some people develop rapid respirations or panic attacks or confusion or hallucinations. We have two kinds of overdoses. We have the acute overdose. That's where first we get the central nervous system stimulation, then we get the fatigue and depression, then the blood pressure goes up and down and circulatory collapse. We have symptoms of nausea, vomiting, diarrhea, and abdominal cramps. And if it proceeds to a fatality, usually goes through convulsions and coma. Now, chronic intoxication with the drug can lead to marked insomnia, irritability, hyperactivity, can change your personality, can cause a psychosis consistent with schizophrenia, can cause a severe rash. But overall, the drug is pretty well tolerated. But it does have those catecholamine releasing properties, same thing as the amphetamines. So we have to be a little bit concerned. If you have cardiovascular condition and take it, you might have some palpitations, you might have hypertension, you might have ischemic events like angina or myocardial infarction, heart attack, or stroke or mini stroke. Can cause some overstimulation of the central nervous system and lead to restlessness and dizziness and insomnia and euphoria, sometimes tremor or headache or psychosis. Can cause dry mouth and unpleasant taste in your mouth. Can cause diarrhea or constipation. Even some people develop hair loss taking the drug, and other people become impotent or suffer from erectile dysfunction when they take the drug. And you can have some withdrawal effects, especially if you've been taking the drug for a prolonged period of time, in excess of the 12 weeks, and at an especially high dose. And remember, we have the abuse potential because we have that association with the amphetamines. So, especially in patients who have an increased dose to several times the normal dose, if they stop it all of a sudden, chances are they're going to have significant withdrawal effects, extreme fatigue and depression, and they're going to have altered sleep pattern, they're going to have some psychoses. Now, if you're pregnant, don't take the pill. There's no potential in the weight loss during pregnancy for the overwhelming majority of women, and it has some potential for fetal harm. 10% of children born to mothers who are taking the drug might have oral clefts, might develop a metabolic acidosis that causes growth retardation and can cause some problems with lack of oxygen in the child. Nursing women, again, it's not a good idea to take the drug. The amphetamines we know appear in the milk. We don't know whether the phentermine itself appears in the milk. In pediatric population, hasn't been studied for safety or efficacy. As you get older, your kidneys don't work as well, and it's principally excreted from the body through the kidneys, so have to be a little bit cautious and maybe start with a lower dose in older people, and also have to watch the liver function as well. Well, drug interactions, certainly a possibility. So if you're taking an MAO inhibitor, not used terribly much anymore, but it can cause a hypertensive crisis. Alcohol causes potential interactions. Remember we said that if you're taking the insulin or the oral hypoglycemic, have to be a little bit careful, may need to take less of those drugs, especially if you start to lose some weight. And if you're taking certain kind of medicines to treat hypertension, might be less effective if you happen to be taking the phentermine. Now, overall, the medicine works as a sympathomimetic amine, so works like noradrenaline, norepinephrine, works like the amphetamines. So it seems that overall, we have a lot of ideas how it might work, the noradrenaline, norepinephrine, maybe it's a reversible weak MAO inhibitor, maybe it has something to do with the serotonin. We don't know if any of those really make a difference. But compared to the amphetamines, we do know that if you take phentermine, it's going to have less effect on your heart, less elevation of your blood pressure, it's going to cause less insomnia, less restlessness than the amphetamines themselves. Overall, you're going to become tolerant to the medicine within a very short period of time. Once you take the pills, the maximum concentration in the body is going to occur in about 3 to 4 hours. The half-life is going to be about 20 hours. Going to be excreted somewhere between 60 and 85% through the kidneys. Well, how about, does it work? Well, if we look at the short-term adult dose, if dietary management is unsuccessful and lifestyle modification and exercise, none of that seems to work, then it might be appropriate to at least consider a drug maybe like phentermine. Well, the magnitude of the weight loss varies from individual to individual, from trial to trial. And as a matter of fact, the amount of the weight loss, it seems, with the drug varies with conditions other than the drug itself. It has to do with the physician-investigator, patient interaction, the population treated, the genetics of the individual, the diet, the physical activity. So we don't really know whether it's the drug or whether it's something else in combination with the drug that seems to cause the weight loss. How much could you lose? Theoretically, a woman is going to lose somewhere between about 3 to 6 pounds a month. A man's going to lose 5 to 8 pounds a month. But that means that some people lose hardly anything. Some people can lose as much as 28 pounds over the course of that 12-week time period that you take the drug, as opposed to a placebo where you can lose about 6 pounds. It seems like once you start taking the drug, the maximum weight loss occurs during the first week or 2 or 3 that you're taking the drug. It seems to work better in people who are younger, heavier, who are more physically active. Now, in the longest trial to date, 36 weeks, people lost about 27 pounds on the phentermine, but they lost about 11 pounds taking a placebo. So the mechanism is it decreases the appetite, it increases the energy, and also increases the water loss. Now, off-label, some people use the drug on repeated courses. So you take the 12 weeks, then you come off for 4 to 8 weeks, then you take it for another 12 weeks. The safety of that hasn't really been established. We know it's similar to the amphetamine, so sometimes people are even using it to treat ADHD, which isn't a really good idea. So overall, how much are we expected to lose? If we have a 200-pound individual, the weight loss might be somewhere around 10 to 20 pounds. Maybe expect 5% of the initial weight could be lost. If you take it over the 12-week period, maybe even could lose as much as 10%. But remember, a lot of that weight is going to come back as soon as you stop taking the pill. And the studies that I just quoted with all those wonderful numbers, they were biased. And we don't really know that unbiased trials would give us the same kind of significant results. Now, for decades, phentermine was the only prescription anti-obesity drug. Then in 2012, a lot of other drugs and drug combinations came available. So there was one called Belviq, another one with phentermine combined with topiramate, another one with naltrexone combined with bupropion. Then we have 2 anti-diabetic medicines. We have the liraglutide and we have the semaglutide. Some interesting information on the semaglutide coming up. So phentermine was approved in 1959. Topiramate was discovered in 1979 and was released by the Food and Drug Administration in 1996. Well, the topiramate's really for seizures and migraine prophylaxis, and off-label it's used for some sleep-related eating disorders and nightmares and PTSD and alcohol abuse. But the combination seems to cause people to lose some weight, and you could lose anywhere between about 9 and 14 or 15% of your baseline weight over the period of half a year to a year. But unfortunately, it has really a cumbersome dose titration to start the drug, to get up to the full dose of the drug. And the drug frequently ends up causing neuropsychiatric effects. It costs a lot of money, and it's teratogenic and cause some problems in women who are pregnant. So you have to, at least if you're a woman of childbearing potential, you have to take a pregnancy test before taking the pill and every month while you're taking the pill. So that doesn't seem to make any sense. But you could lose some significant amount of weight. But more than 50% of the people who take the drug discontinue it because of paresthesias, numbness and tingling of the extremities, or cognitive changes, or dry mouth, or depression. And then a word on this Phentermine combination. It was originally introduced in France in the 1960s, came to the United States in the 1970s. The combination, the fen-phen, the name was coined in 1994. It was very popular through 1996. Seems that you get about the same amount of weight loss taking the fen-phen as if you just took the Phentermine by itself. But it became a fad, and about 6.5 million people took the drug. But unfortunately, that was when we had the increase in the incidence of the heart valvular disease and the pulmonary hypertension and sudden cardiac deaths. So the drug company voluntarily withdrew the the fenfluramine from the market. Remember that Phentermine by itself, well, that was approved in 1959, and we don't really have all that many side effects as a result of the drug. Now, weight loss is extremely complicated. There are a lot of different mechanisms. It has to do with the breakdown of the fat cells, the production of heat by the fat cells. It has to do with the gut and the bile and the bugs in the intestine. It has to do with the kidneys. It has to do with the GI tract. So, unfortunately, we're not going to have a one-size-fits-all therapy. But while we're talking about these kind of therapies, let's just make note of hydroxycut. It was introduced in 2002. The principal ingredient is Caffea canephora. That's Robusta coffee. It's a coffee bean that hasn't been roasted yet. Seems that maybe the active ingredient is the chlorogenic acid. Well, they had some problems. In about 2004, there was ephedra in the product, and that was causing some problems, so it was discontinued. And then in 2010, came back on the market. You could lose about 8 pounds over a period of 8 weeks if you're taking the medicine. But again, not going to last once you stop. So if we talk about Phentermine, it seems that it has the ability to make people lose some weight. Unfortunately, the maximum course of taking the drug should be about 12 weeks, and if it works only if you're taking a calorie-restricted diet. And if you stop taking the drug, the weight seems to return. Well, the real exciting thing about weight loss is, of course, we're learning more about the basic pathophysiology of weight loss. And there's a drug called semaglutide. Now, semaglutide is probably going to be approved by the Food and Drug Administration in mid-2021. It's the same chemical as in Ozempic and Rybelsus, two anti-diabetic medicines. Downside is it's going to be costly. It's going to be a once-weekly injection. So if you have a few pounds to lose, diet's still the only way to go. Exercise is a useful adjuvant. So if you take it and you exercise, chances are you're not going to lose the weight. You've got to restrict the calories. Everything comes back down to the diet. Diet is the primary way to lose the weight. Now, if you're interested in weight loss, some people say the ketogenic type diets, the keto diets, happens to be the rage right now. And studies show that it might even be a better diet than the one proposed by the American Diabetes Association, even the American Heart Association diet. You have to remember that not all calories are created equally. So in order for you to lose weight, and lose weight successfully, may require long-term change in your diet. And it's not just the calories you consume, it's the type of calories. And people talk about calorie-restricted diets, Well, that's probably a good idea for many people, but the more we learn about calorie-restricted diets, they're losing some of their luster too. Anyway, thanks for watching. If you enjoyed the show, please tell a friend. Consider subscribing so you'll be notified as we post new videos. I appreciate your interest. I'm Dr. Ken Landau.